your pancreas might be in trouble, and you wouldn't even know it until it's too late. Most people ignore the early warning signs, brushing them off as minor issues, but that's a big mistake. The pancreas is one of the most overlooked organs in your body. It works silently, breaking down food and keeping your blood sugar in check. But when it starts to weaken, the symptoms aren't always obvious. You might feel bloated after meals, have unexplained weight loss, or notice changes in your digestion, things that seem small but could be warning signs of something serious. If you catch these signs early, you can take action before major damage happens. In this video, we're revealing 6 early warning signs that your pancreas is struggling. Ignoring them could lead to digestive problems, diabetes, or even something more life-threatening. Stay with me, because what you learn today could make all the difference for your health. Let's get started. Number 1. Persistent digestive issues. Digestive discomfort is something many people brush off, assuming it's just a normal part of aging, stress, or diet choices. But persistent bloating, gas, and indigestion, especially after meals, could be an early sign that your pancreas is struggling. If you frequently feel overly full, even after eating small portions, or notice that your digestion seems slower and heavier than usual, it may not just be random stomach trouble. These symptoms could indicate that your pancreas isn't producing enough digestive enzymes, leading to improper food breakdown. When your pancreas weakens, it struggles to release the necessary enzymes to digest fats, proteins, and carbohydrates properly. As a result, undigested food sits in your stomach and intestines longer than it should, causing excessive gas, bloating, and discomfort. Fatty foods, in particular, become difficult to digest, leading to that heavy, sluggish feeling after meals. This enzyme insufficiency is often an early warning sign of chronic pancreatitis, pancreatic insufficiency, or even more serious pancreatic conditions. Unfortunately, because these symptoms resemble common digestive issues, many people dismiss them until the damage worsens. Several factors increase the risk of pancreatic enzyme deficiency. A diet high in processed or fatty foods forces the pancreas to work overtime, potentially leading to chronic inflammation. Alcohol abuse and smoking are also major contributors to pancreatic stress, as both can damage the cells responsible for enzyme production. Additionally, if you've had gallbladder issues in the past, your pancreas may already be under extra strain. So when should you be concerned? Occasional bloating or mild indigestion isn't alarming, but if these symptoms occur daily or consistently after meals, it's time to take action. Persistent digestive issues that don't improve with over-the-counter remedies or dietary adjustments warrant medical attention. A doctor can determine if your pancreas is underperforming and suggest lifestyle changes, enzyme supplements, or further tests to assess pancreatic health. Catching this problem early can prevent malnutrition, weight loss, and more severe complications down the road. Listen to your body. Your pancreas may be trying to tell you something important. Number 2. Unexplained weight loss. Losing weight without trying might sound like a dream come true for some, but when it happens without any changes to your diet or exercise routine, it could be a serious red flag, especially for your pancreas. If your clothes are suddenly fitting looser, you're feeling weaker, or you're constantly fatigued despite eating normally, your body may not be absorbing the nutrients it needs. This is often one of the first signs that your pancreas isn't functioning properly. The pancreas plays a crucial role in digestion, releasing enzymes that help break down fats, proteins, and carbohydrates so your body can absorb them efficiently. When the pancreas weakens, enzyme production decreases, leading to malabsorption, a condition where essential nutrients pass through your body without being properly absorbed. This means that even if you're eating a balanced diet, your body isn't getting the fuel it needs, resulting in unexplained weight loss. In some cases, this is accompanied by steatorrhea, which refers to pale, greasy, and foul-smelling stools. If your stool is floating or difficult to flush, it may be a sign that undigested fat is being excreted rather than absorbed. Several serious conditions can cause pancreatic-related weight loss. Chronic pancreatitis can slowly destroy pancreatic tissue over time, leading to enzyme insufficiency and malabsorption. Undiagnosed diabetes can also cause unintentional weight loss, as the body struggles to regulate glucose properly. In more severe cases, pancreatic cancer can trigger rapid, unexplained weight loss, as the tumor affects digestion and metabolism. Because the pancreas doesn't give obvious distress signals early on, significant or continuous weight loss should never be ignored. If you've been shedding pounds without explanation, especially if you're also feeling weaker, more fatigued, or noticing changes in your stool, it's crucial to consult a doctor. Unexplained weight loss isn't just about appearance, it's a sign that your body isn't getting what it needs. Early detection of pancreatic issues can help prevent further complications, ensuring your body remains strong and properly nourished. Number 3. High blood sugar levels. High blood sugar levels can be one of the earliest warning signs that your pancreas is struggling. If you find yourself constantly thirsty, running to the bathroom more often, feeling exhausted for no reason, or experiencing unexplained hunger, your pancreas might not be producing enough insulin. Insulin is the hormone responsible for keeping blood sugar levels in check, and when your pancreas starts to weaken, blood sugar can rise beyond healthy levels. When the pancreas stops producing enough insulin, sugar builds up in the bloodstream instead of being used by your cells for energy. As a result, your body tries to flush out the excess sugar through urine, leading to frequent urination and dehydration, which in turn causes persistent thirst. Meanwhile, since your cells aren't getting the energy they need, you may feel constantly fatigued and sluggish, even after a full night's sleep. Some people experience blurred vision, as high sugar levels pull fluid from the lenses of the eyes, making it harder to focus. Others feel constantly hungry, as their body struggles to process glucose efficiently. This condition could be an early sign of prediabetes or type 2 diabetes, both of which can develop when the pancreas can't produce or regulate insulin properly. In some cases, high blood sugar levels may indicate pancreatic damage due to chronic inflammation or other underlying conditions. If left unchecked, persistently high blood sugar can lead to severe complications, including nerve damage, kidney problems, and heart disease. Certain factors increase the risk of pancreatic-related blood sugar issues, including a family history of diabetes, obesity, and a poor diet high in processed sugars and unhealthy fats. If you notice these symptoms regularly, don't ignore them. Persistent thirst, excessive urination, unexplained fatigue, or recurring blood sugar spikes should prompt you to get tested. Detecting blood sugar imbalances early gives you the chance to make lifestyle changes, manage your pancreas's health, and prevent more serious complications from developing. Pay attention, your pancreas may be sending you a warning. Number 4. Abdominal pain that radiates to the back. Abdominal pain that radiates to the back is one of the most telling signs that something is wrong with your pancreas. Unlike typical stomach aches, this pain is deep, persistent, and often worsens after eating fatty foods. It can feel like a dull ache, a sharp stabbing pain, or even a burning sensation that starts in the upper abdomen and moves toward the back. Some people experience it in waves, while others feel a constant discomfort that doesn't seem to go away with common remedies like antacids or pain relievers. This type of pain is often linked to pancreatitis, which is the inflammation of the pancreas. When the pancreas becomes irritated or damaged, digestive enzymes that are supposed to break down food begin attacking the pancreas itself, leading to severe pain and inflammation. In some cases, A growing pancreatic tumor can also press on nerves and surrounding organs, causing unexplained abdominal discomfort. Because pancreatic pain is located deep within the abdomen, it tends to radiate to the back, making it distinct from regular indigestion or stomach cramps. Certain risk factors make pancreatic pain more likely. A history of gallstones can obstruct the pancreatic duct, leading to inflammation and pain. Heavy alcohol consumption is another major contributor, as it can inflame and damage pancreatic tissue over time. Smoking has also been linked to an increased risk of both pancreatitis and pancreatic cancer, making it a serious concern for those experiencing this kind of pain. If you have persistent upper abdominal pain, especially if it worsens after meals or radiates to your back, don't ignore it. Pain that lasts more than a few days or comes with other symptoms like nausea, vomiting, or fever could indicate a serious issue requiring immediate medical attention. Ignoring pancreatic pain could allow inflammation or even cancer to progress undetected. If you're experiencing these symptoms, seek medical advice. Early detection can prevent long-term damage and serious complications. Number 5. Greasy, pale, or foul-smelling stools. If you've noticed that your stools are greasy, pale, or unusually foul-smelling, your pancreas may not be working properly. This isn't just an occasional digestive issue. Persistent changes in stool appearance and texture could be a major red flag for pancreatic problems. Stools that float, appear oily, or are difficult to flush indicate that your body isn't properly digesting fats, which can lead to nutrient deficiencies and weight loss over time. If you also experience chronic diarrhea or your stools have a persistent yellowish or clay-colored tint, it's time to pay attention. These symptoms are typically caused by steatorrhea, a condition where excess fat remains in the stool because the pancreas isn't producing enough digestive enzymes. Normally, pancreatic enzymes break down fats, proteins, and carbohydrates, allowing your body to absorb nutrients efficiently. But when the pancreas weakens, whether due to chronic inflammation, damage, or disease, undigested fat passes through the intestines and exits in the stool. This leads to stools that are oily, bulky, foul-smelling, and harder to flush. Exocrine pancreatic insufficiency, EPI, is a condition where enzyme production is significantly reduced, leading to ongoing digestive problems. Several factors can increase your risk of developing these issues. Chronic pancreatitis, which results from prolonged inflammation, can severely damage enzyme-producing cells over time. Cystic fibrosis, a genetic condition, also affects pancreatic function, leading to mucus buildup and enzyme blockages. Long-term alcohol abuse puts immense strain on the pancreas, increasing the likelihood of enzyme insufficiency and malabsorption. If these stool changes last for more than a few weeks, or you find yourself dealing with persistent diarrhea, weight loss, or signs of malnutrition, consult a doctor immediately. Left untreated, pancreatic enzyme deficiency can lead to severe vitamin deficiencies, bone loss, and serious digestive complications. Paying attention to what your body eliminates might seem unpleasant, but it can provide crucial insights into your health. Your pancreas could be sending you a warning. Number 6. Nausea and loss of appetite. Feeling nauseous after meals or losing your appetite might not seem like a big deal at first, but when it happens frequently, it could be a sign that your pancreas is struggling. If you find yourself avoiding meals because eating makes you feel sick, or if you've noticed a sudden drop in your appetite, it's time to pay attention. Occasional nausea is normal, but persistent nausea, unexplained vomiting, or a consistent loss of interest in food could indicate an underlying pancreatic issue that needs medical attention. When your pancreas weakens, it doesn't produce enough digestive enzymes to break down food properly. This can make digestion sluggish and uncomfortable, leading to nausea shortly after eating. Instead of smoothly processing food, your stomach and intestines struggle, causing an uneasy or queasy feeling that can linger for hours. In some cases, the body reacts by vomiting, especially after consuming fatty or heavy foods. This happens because the pancreas isn't releasing the enzymes needed to digest fats, leaving them to sit undigested in the stomach. Chronic pancreatitis, which is long-term inflammation of the pancreas, is one of the most common causes of nausea and appetite loss. As the pancreas becomes more damaged, digestive enzyme production declines, making eating a discomfort rather than a source of nourishment. In more serious cases, pancreatic cancer can also trigger persistent nausea and appetite loss. Tumors in or around the pancreas can interfere with digestion and create a feeling of fullness, even after eating very little. Many people dismiss early appetite changes as stress or aging, but when combined with other pancreatic warning signs, they should not be ignored. Certain lifestyle factors increase the risk of pancreatic-related nausea. A diet high in processed foods and alcohol puts excessive strain on the pancreas, increasing inflammation and enzyme depletion. Chronic pancreatitis, long-term alcohol use, and smoking are also major contributors to pancreatic dysfunction. If nausea lasts for several weeks, worsens after meals, or is accompanied by weight loss or vomiting, consult a doctor immediately. Ignoring these signs could allow serious pancreatic conditions to go undiagnosed, leading to complications that could have been prevented with early intervention. What happens if you ignore these signs? Ignoring the early warning signs of a weak pancreas can have devastating consequences. What starts as mild bloating, weight loss, or changes in stool can quickly escalate into permanent digestive damage, malnutrition, diabetes, or even pancreatic cancer. Chronic pancreatitis is one of the most serious outcomes. When the pancreas is repeatedly inflamed, its ability to produce digestive enzymes deteriorates, leading to long-term exocrine pancreatic insufficiency, EPI. This means food isn't properly broken down, causing severe nutrient deficiencies, persistent diarrhea, and weight loss. Over time, chronic inflammation can cause irreversible scarring of the pancreas, making it harder for your body to digest food and absorb essential vitamins. Without proper enzyme function, malnutrition sets in, leading to bone loss, muscle weakness, and immune system suppression. Deficiencies in vitamins like A, D, E, and K can cause problems ranging from vision issues to increased risk of fractures. Meanwhile, if the pancreas loses its ability to produce insulin, diabetes develops, increasing the risk of nerve damage, kidney disease, and cardiovascular problems. Perhaps the most alarming risk is pancreatic cancer, which is often diagnosed too late because symptoms are ignored. The earlier you catch pancreatic dysfunction, the better your chances of preventing life-threatening complications. Ignoring these signs could cost you your health or even your life. How to keep your pancreas healthy. Keeping your pancreas healthy isn't just about avoiding disease, it's about protecting one of the most vital organs in your body. The good news? Small lifestyle changes can make a big difference in keeping your pancreas strong and functioning properly. Start with your diet. Reducing high-fat and processed foods eases the strain on your pancreas, making digestion more efficient. Instead, focus on fiber-rich foods like vegetables, fruits, and whole grains, which help regulate digestion and blood sugar levels. Lean proteins such as fish, chicken, and plant-based sources provide essential nutrients without overloading your pancreas with unhealthy fats. Your lifestyle choices also play a major role. Smoking and excessive alcohol consumption are two of the biggest risk factors for pancreatitis and pancreatic cancer. Quitting smoking and drinking in moderation, or avoiding alcohol altogether, can significantly reduce your risk of long-term pancreatic damage. Staying hydrated supports enzyme production, While regular exercise helps maintain a healthy weight, reduces inflammation, and improves insulin sensitivity, protecting your pancreas from diabetes. Even small steps, like daily walks or stress reduction techniques, contribute to overall pancreatic health. Your pancreas works hard for you. Take care of it before it's too late. Your pancreas is one of the most essential yet overlooked organs in your body. If you experience persistent digestive issues, unexplained weight loss, high blood sugar spikes, abdominal pain, nausea, or greasy stools, don't ignore them. These could be early warning signs that your pancreas is in trouble, and catching them early can prevent serious complications like chronic pancreatitis, diabetes, or even pancreatic cancer. Your pancreas works hard for you every day. It's time to take care of it. If you've noticed any of these symptoms, don't wait. Visit your doctor, make the necessary lifestyle changes, and prioritize your health before it's too late. Small changes in diet, hydration, and exercise can go a long way in keeping your pancreas strong. If you found this video helpful, make sure to like, share, and subscribe for more health tips. Spread the word. Someone you know might need this information today.